So I'm giving a talk on cellular-mediated immunity for CMV and how this can help us managing patients with CMV infection. And as you all know, CMV or cytomegalovirus is still one of the most common infection after hematopoietic cell transplantation, especially allogenic HCT recipients who are seropositive, the recipient at least. So this is pretty common, and we try to identify some new tools which can help us manage these patients. And one of these tools actually to test for cellular-mediated immunity for CMV to know if our patient after transplantation, are they still susceptible for CMV, or they can be protected from CMV reactivation, CMV disease, based on this assay. And we conducted a few studies, us and many other groups as well, and not only in the hematopoietic cell transplant world, but as well as in patient after solid organ transplant. And so many studies, and most of the studies showing that it is helpful to know first who to predict who may reactivate their CMV or end up with bad outcome with CMV infection, but also can help us to determine who need to be on prolonged prophylaxis, especially now when we have a new drugs available to prevent CMV infection, at least after allogenic transplantation in adult, which is letermovir. So the duration of prophylaxis, or if you have a low level of CMV reactivation, would you need to jump the guns and start treating these patients? And I'm sure we've been over-treating for many years. Some patient may have resolution of their infection without treatment. So having an extra tool on hand to determine who really need to be treated or treated aggressively may help improve the outcome of CMV infection after transplantation.